Right, what would happen if you don't stitch the skin after a tattoo excision? What the heck question is that? What's that? That smacks of someone who wants to cut their tattoo out and not stitch the skin. Well, so if you do a tattoo excision, so if you actually cut that full thickness of skin out, as opposed to something like dermabrasion, where you kind of just get an angle grinder or dermabrader, but kind of like just take the top layer of the skin off. So if you're just taking the top layer of the skin off and you're leaving some skin behind, then that skin will heal a bit like a skin graft donor site heals. You just take the top half of the skin off and that skin will heal. But if you're doing a proper tattoo excision, so you're taking the full thickness of the skin, which is what you do with a tattoo excision, and you don't stitch it, then it will heal by what we call secondary intention, which basically means healing from the sides across. So when you do a partial thickness injury or wound, like a dermabrasion, or as I say, a skin graft harvest, or a burn, for instance, a not a full thickness burn, because there's some skin left behind, that skin will heal from the skin that's left behind. So it will heal relatively quickly. It'll heal in a week or so, that skin will be healed. Whereas if you've got, and it doesn't matter how big that injury is, really, a skin graft donor site, theoretically, a very small skin graft donor site versus a very big one should heal in the same amount of time. Now, obviously, a very big one's going to have more areas where you're going to prone to little bits that don't heal. But on paper, theoretically, they should heal in the same amount of time because they're healing from the base up. Whereas a full thickness wound, a bigger wound is going to take a lot longer to heal than a smaller wound because it's got to heal from the sides across. The skin's got to come from the sides across. It's not coming from the base. So it'll heal by what's called secondary intention. Now, small wounds can heal quite well from secondary intention. Sometimes if you take moles off or something like that, or you do some kind of skin excision and the wound opens up, and the patient goes, oh my God, it's opened up, it looks terrible, you've got to restitch it and all that. Personally, I pretty much never restitch it because you worry about stitching infection and stuff. So you usually leave it, and it often heals really well. And you think, crikey, what did I bother stitching it for? Now, it takes a bit longer to heal, but it can heal really well for a small area. But tattoo excisions are not normally small areas, but small areas can heal quite well. You have to keep them moist, keep them clean, and let the favourable for the wound to heal. But yeah, that is what would happen. It would heal by secondary intention. The other thing about healing by secondary intention is that volume of scarring will be greater. Now, again, when these wounds, when these moles and things break down and open up, the scarring can be pretty bad to start with, but it does actually shrink and it does contract, and it's often not as bad as it looks to start with. So not that I'm encouraging people to excise tattoos and not stitch them up, but for small wounds they can actually not look that bad, but for a bigger wound you would not want to leave it. Like what normally say is like anything bigger than a 50p piece is just going to take absolutely ages to heal. So you wouldn't really want to not stitch them up. It's gonna, because if you stitch it up, it should be healed in a week. Should be, not always. But if you don't stitch it up, then it can take literally months, absolute months, if you have a big wound, and it's completely not worth it because there's a risk of infection and all sorts, and you have to have dressings during that time. So there's all sorts of issues with it. So not recommended.